Welcome to AI in Real Life, real talk with real experts, an effort on behalf of the AI Institute for Societal Decision Making. In this podcast, we dive deep into how artificial intelligence shapes our world and everyday decisions. I'm Katie, the host of this podcast and an undergraduate at Carnegie Mellon University. In this episode, we're exploring the pivotal role of AI in public health with Professor Milind Tambe, a leading figure at the intersection of AI and societal decision making. Professor Milind Tambe is Gordon McKay Professor of Computer Science and Director of the Center for Research in Computation and Society at Harvard University. He's also the Principal Scientist and Director for AI for Social Good at Google Research. Professor Tambe, can you briefly introduce yourself and your lines of research?
So my work is focused on AI for social impact. For the past 15 years or more, my team and I have been focused on advancing AI for topics of public health, conservation, and public safety, with the key challenge of how to optimize our limited intervention resources. So that leads to, on the one hand, social impact, but on the other hand, it also leads to advances in AI research.
I see. Okay. Then just to kick things off, can you explain what are some current public health issues are and how does AI is currently being applied to solve them?
There are a very large number of public health issues because public health touches on so many topics of human life. The most recent issue that all of us are aware of is, of course, COVID, and that was obviously a massive public health challenge. But there are other challenges. Tuberculosis, for example, kills millions of people worldwide. And so that's also a disease that needs to be eradicated. And in fact, there is a declaration that TB needs to be eradicated in the next 10 years or so. Maternal and child health, the UN Sustainable Development Goal is that maternal mortality ratio, that is mothers dying during childbirth or soon after, should be below 70 per 100,000 live births. But worldwide, the numbers are more than double that. In fact, there are many challenges in public health. Sadly, whereas I would argue that in AI in medicine has received a lot of attention, AI in terms of public health, in terms of population health, in terms of global health, has not received that much attention. And so, in fact, it would be wonderful if we can get more people to be focused on this topic of how can we bring AI to the benefit of populations worldwide where there are these challenges of tuberculosis and HIV prevention and maternal mortality and so many others where AI could potentially have a big impact. And so, whereas I can point to one or two challenges whereby one or two success stories, for example, Google's work on diabetic retinopathy is one such example. There are many challenges which remain to be addressed. And if you think about future pandemics, that is clearly going to be a massive issue for public health where AI could be of tremendous help.
Right, got it. Then I'm curious, based on your experience, what are the key considerations where AI can be more effective in making social impact?
So in my lectures, in my class, there's a whole lecture on, what appears to work when we apply AI for social impact and what fails. I don't think we have a very clear idea on when things will succeed or fail, but there are, from other researchers, a compiled list of questions that need to be addressed as yes in order for AI to achieve social impact. So usually this work requires partnership between an AI researcher and a nonprofit or a government agency that is focused on, generally speaking, some marginalized population. And this partnership is absolutely crucial. And then we need to ask a number of questions within the partnership. First, is there data? First of all, is there a problem which AI could address in that? Is that problem an important problem, or will solving it actually not impact as much? Is there data available? So I have certainly met organizations where the problem sounds wonderful, AI could certainly help, but there is no data that they can share with us. if they share data, if we develop a solution, would they be able to test it in the field? Because if they can't test it and there is no success, we can't evaluate it, then we don't know. And then supposing we do a pilot test, it works, would they be able to deploy it and scale it up? And who's going to maintain that solution afterwards? Because there's a prototype, it works, but afterwards, when the research is done and all the publicity goes away, that software needs to be maintained. There are a number of these questions that need to be addressed as yes in order for us to have a successful partnership. And on the other side, from an AI researcher's perspective, the key is really to be patient in this partnership and to make sure that it is not the case that we take the data from some organization in our ivory tower, maybe develop a solution, and then just say, okay, here's a solution, without sort of continuous partnership throughout the whole process. Another failure mode is that we completely independently of a partner develop a solution to some imagined public health problem, and then we go try to use it because maybe it's really not a solution that works. So it's a very important question to answer and try and understand. And as we develop the whole science of AI for social impact, which I believe will be an important aspect of future of AI, we have to be able to understand this question. So it's an important question. We have some initial ideas of how to answer it, but a lot more needs to be understood.
Got it. Thank you so much. I think I remember the last conversation with Artie. She also mentioned about the back and forth process of like deploying all this project. And I'm curious, what does it mean to have a partnership in these public health agencies?
It means they have to be on the ground floor. We should begin our process by immersing ourselves in the domain, trying to understand the kind of data that is available, the types of challenges that they actually face, rather than we going to them saying, here's a solution to your problem without even understanding what is the problem. And then step by step, developing a solution in consultation with this agency, this partner agency. So next step could be we make predictions on which of the cases they face are high risk versus low risk. Following that, because we may not have enough intervention resources, we have to decide which cases to actually intervene on, which AI could decide. But in all of these situations, we need their input rather than us going and developing solutions. There are others who have warned about AI researchers, not only AI researchers, but other scientists being taken by the idea of their, showing off the brilliance in their solution, because unfortunately our fields reward us for the brilliance of the technique rather than the impact on actual societal problem. And so to not get too much into how complicated or brilliant is our technique, independent of how much impact it would actually have, but to stick to what is really impactful and pursue this partnership towards impact. And so that's what a real partnership would mean. And then, of course, we want to evaluate the system in the field with our partner to make sure that we actually achieve the impact that we aimed for from the beginning. So I'll summarize it by saying it's partnership, 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 beginning to end for AI for social impact.
Moving to your work with AI SDM, what specifically are you focusing on within the public health thrust, and how does your work aim to solve the public health challenges?
So the key thrust we are focused on in the context of AI SDM is maternal and child health. I mentioned earlier the UN Sustainable Development Goal to have the maternal mortality ratio to be below 70 per 100,000 live births. Even in the United States, the situation is not that excellent. And so certainly worldwide, the numbers are much worse, more than double, as I said. We are focused on the challenges faced in India, where the numbers are declining, but they're still double. Mothers dying during childbirth and so forth are still double the UN target. And we are very fortunate to be working with a nonprofit called Arman. And with them, we are focused on their mobile health programs. So our work, so just to give you a very quick idea, the mobile health program essentially exploits the fact that cell phones are now available everywhere cheaply, and cell phone services. So the programs then send automated health messages to mothers about taking iron pills, taking calcium pills, things of that sort. And these messages go out appropriate to the gestational age or the age of the baby after the baby is born up to the child being 1 year old about getting vaccination and so forth. So the idea is that if mothers listen to these messages, there's 140 of these, then compared to mothers who don't listen, there's a significant improvement in their health. Unfortunately, mothers register in this mobile health program, but then they drop out of the program. And so question is, how do we prevent this drop off? AI can help. AI can pinpoint before these mothers drop off who are the ones who are likely to drop off, so that Arman can then send intervention resources to these mothers, health workers to their homes perhaps, to persuade them to not drop off of the program or give them phone calls. But given there's large populations to serve and limited number of interventions, who do you intervene on? If there's 200,000 mothers that are enrolled in the program, but you can only call 1,000 of them, which ones would you call? Machine learning AI can help in pinpointing which 1,000 every week that you can call in order to prevent them from dropping off the program. And so we have in our work shown through AI, having conducted field trials, that AI can prevent drop-off rates by 30% over the control group. And so that's been an exciting focus of our work in terms of not only showing this, but then deploying it in the field and continuing to improve this work.
Yeah, that's so impressive. And I understand that while like deploying those projects alongside with the technical challenge, there are also like ethical and cultural factors that can influence the deployment of AI. And I wonder, how does these factors influence the solution, and how does you and your team address those concerns?
So first of all, this is an extremely important question to be sure to address a responsible AI deployment. And to that end, one of the main ideas, of course, as I mentioned earlier, is this deep partnership with the organization that we're working with, so that we have complete sense of what are the sensitive points and so forth. So in our deployment, there are two things that we've done. First, after deploying or even during, to continuously test that for all the sensitive attributes that they care about, sensitive features. In our case, for instance, we are serving populations where 95% of the families have incomes that are below the international poverty line. And so even within that, there are people who may be less educated, people who have even lower income. So to make sure that the services are distributed equitably across these different groups. So that's one approach. And so we have tested our solutions to make sure that they indeed distribute resources equitably across these different marginalized populations. So even within the marginalized, sort of even more marginalized population. But it is an important area of work. It's not solved, but it's an important area of work. So we are also pursuing research so as to make sure that there is equitable allocation of these resources. And furthermore, to empower these nonprofit organizations, not only the one we are working with, but also others, so that they can by themselves, without the AI researchers necessarily stepping in between, be able to direct the AI system to their needs. And so that's another line of work that we are also pursuing. So without requiring an AI researcher, could the organization that is interested directly change the AI system so that if they observe any challenges in terms of fairness or things of that nature, that they by themselves can begin to address it by automatically directing the AI system via natural language to correct for any errors that might be creeping in or any mistakes that they perceive are happening and so forth. So that's another line. I mean, these are all works of, that are for future work, but
Yep.
that's the thing that we're pursuing as well.
Got it. Thank you so much. And then by looking forward, how do you think might AI impact the public health or medical field more broadly in the future?
I would make a slight distinction between medicine
Yeah.
and public health and global health. And I would, in fact, argue that we really need many more resources towards AI for global health and for public health. We really need, it hasn't received as much attention. But on the other hand, as I outlined earlier, there are so many important challenges that impact huge sections of the world. Tuberculosis or other HIV prevention and so forth are important challenges that are faced by large populations in the world, but they haven't received as much attention as I think we could give them. And with AI researchers, if they are able to collaborate with organizations in the field or researchers in public health and global health, we can see a huge impact in this area. And it's not only beneficial for the beneficiaries in the end, but I believe that it will also lead to completely new directions for AI research.
Thank you so much, Professor Tambe, for sharing your expertise and insights with us today. As we close out today's episode, I'd like to remind our listeners of a unique opportunity to deepen your engagement with the fascinating world of AI in societal decision-making. Visit our website at www.cmu.edu/AI-SDM and find the Google form to submit your questions to AI-SDM experts. This is your chance to contribute to the conversation and possibly have your questions featured and explored in our upcoming episodes. Don't forget to subscribe to our podcast for more in-depth discussion on how AI shapes our society. Thanks for tuning in, and we're looking forward to having you guys with us on AI in Real Life.